health officials have recruited the CDC to help with the growing crisis inside nursing homes. KCAL9's Dave Lopez has today's developments.
Through autopsies, Santa Clara County has proven that the first 2 deaths from the coronavirus happened on February 6th and the second on February 17th, much earlier than reported. Could that have happened here in LA County?
I think everybody in public health would say that we anticipate that there were many more early deaths across the country that weren't captured.
But the doctor said there is no way to ever know if there were early deaths from the coronavirus in Los Angeles in February or even in January or December.
Many people who passed away early on in February or even earlier may not be able to test them any longer. I think it's unfortunate we might not have that information, but we would anticipate that across the country, particularly in travel hubs like LA County is, that we were probably seeing some infection much earlier on than what we were able to diagnose.
In discussing today's numbers, the skilled nursing homes are still a problem.
Part of that is our obligation to make sure that we're able to test all residents and employees for the virus, regardless of whether they show symptoms.
She was talking about the number of positive cases and deaths that continue to mount at the skilled nursing homes in the county.
We also have 5 new members from CDC who are joining our staff.
It's an all-out attempt to slow down the outbreak at those facilities. There was, however, encouraging news about flattening the curve in this battle against the virus.
As a result of physical distancing, our current best projection is that the number of new cases will remain steady, as you'll see on the white line on the slide.
Which means there will be no shortage of hospital beds, ICU beds, or ventilators. The model showed if we ease up on the physical distancing,
19 out of 20 would have been infected. And if we maintain our current levels of physical distancing, that falls dramatically to on the level of about 2 in 20.
Other counties, like Orange County, have eased restrictions. The doctor said, don't be tempted to go there.
And I'm being honest, when you go, you run the risk, because there'll be many more people there, of running into people who are asymptomatic, but they're able to infect you, and then you will bring that infection back to LA County.
So heed the warning, the doctor said. We've come this far. Don't give up now. From downtown Los Angeles, Dave Lopez, KCAL9 News.